Hello guys, I hope so that you will be fine and enjoying good health. Today I have selected a topic on blood dyscrasia which is called as thalassemia. So let us discuss what is thalassemia. So as you know guys that the thalassemia is an inherited blood disorder that causes your body to have less hemoglobin than normal, and hemoglobin enables red blood cells to carry oxygen. Thalassemia can cause anemia, leaving you fatigued. If you have mild thalassemia, you might not need treatment, but more severe forms might require regular blood transfusions. You can take steps to cope with fatigue, such as choosing a healthy diet and exercising regularly. What are the symptoms? There are several types of thalassemia. The signs and symptoms you have depend on the type and severity of your condition. Thalassemia signs and symptoms can include fatigue, weakness, pale or yellow skin, and facial bone deformities, slow growth or stunted growth, abnormal swellings, abdominal swellings, and the dark urine. Some babies show signs and symptoms of thalassemia at birth. Others develop them during the first two years of their life. And some people who have only one affected hemoglobin gene do not have thalassemia symptoms. When to see a doctor? Make an appointment with your child's doctor for an evaluation if he or she has or any of the signs or symptoms of thalassemia. What are the causes? Thalassemia is caused by mutation in the DNA of the cell that make the hemoglobin, the substance in the red blood cell that carries the oxygen throughout your body. The mutation associated with the thalassemia are passed from parent to children. Hemoglobin molecules are made of chains called alpha and beta chains that can be affected by mutations. In thalassemia, the production of either the alpha or beta chains are reduced, resulting in either alpha thalassemia or beta thalassemia. In alpha thalassemia, the severity of thalassemia you have depends on the number of gene mutations you inherit from your parents. The more mutated gene, the more severe your thalassemia. In beta thalassemia, the severity of the thalassemia you have depends on which part of the hemoglobin molecule is affected. Alpha thalassemia, now we will discuss about it. 4 genes are involved in making the alpha hemoglobin chain. You get 2 from each of your parents if you inherit one mutated gene. You will have no signs or symptoms of thalassemia, but you are a carrier of the disease and can pass it on to your children. Then there is 2 mutated genes. Your thalassemia signs and symptoms will be mild, and this condition might be called alpha thalassemia trait. Then 3 mutated genes, your signs and symptoms will be moderate to severe. Inheriting 4 mutated gene is rare and usually results in stillbirths. Babies born with this condition often die shortly after birth or require lifelong transfusion therapy. In rare cases, a child born with this condition can be treated with transfusions and stem cell transplantation. Now we come to the beta thalassemia. 2 genes are involved in making the beta hemoglobin chain. You get one from each of your parent. If you inherit one mutated gene, you will have mild signs and symptoms. This condition is called thalassemia minor or beta thalassemia. 2 mutated genes, your signs and symptoms will be moderate to severe. This condition is called thalassemia major or Colles anemia. Babies born with 2 defective beta hemoglobin genes usually are healthy at birth but develop signs and symptoms within the first 2 years of life. A milder form called thalassemia intermedia also can result from the 2 mutated genes. What are the risk factors involved? Factors that increase your risk of thalassemia include family history of thalassemia. Thalassemia is passed from parents to children through mutated hemoglobin genes. Certain ancestry. The thalassemia occurs most often in African Americans and in most people of Mediterranean and Southeast Asian descent. What are the complications? Possible complications of moderate to severe thalassemia include iron overload. People with thalassemia can get too much iron in their bodies either from the disease or from frequent blood transfusions. Too much iron can result in damage to your heart, liver, and endocrine system, which include hormones producing glands that regulate the process throughout your body. And then infection. People with thalassemias have an increased risk of infection. This is especially true if you have had your spleen removed. You have had an operation of splenectomy. In case of severe thalassemia, the following complications can occur, such as bone deformities. Thalassemias can make your bone marrow expand, which causes your bones to widen and this can result in abnormal bone structure, especially in your face and skull. And bone marrow expansion also makes bones thin and brittle, increasing the chance of broken bones. Then enlarged spleen or splenomegaly. The spleen helps your body fight infection and filtered unwanted material such as old or damaged blood cells. Thalassemia is often accompanied by the destruction of large numbers of red blood cells. This causes your spleen to enlarge and work harder than normal. An enlarged spleen can make anemia worse, and it can reduce the life of the transfused red blood cells. If your spleen grows too big, your doctor might suggest surgery to remove it and slowed growth rates. Anemia can both slow a child's growth and delay the puberty. And the heart problems, congestive heart failure and abnormal heart rhythms can be associated with severe thalassemia. What is the prevention? In most cases, you cannot prevent thalassemia. If you have thalassemia or if you carry a thalassemia gene, consider talking with your genetic counselor for guidance if you want to have children. There is a form of assisted reproductive technology diagnosis which screens an embryo in its early stages for genetic mutations combined with in vitro fertilization. This might help parents who have thalassemia or who are the carriers of defective hemoglobin gene and have healthy babies. The procedures involves retrieving the mature eggs and fertilizing them with sperm in dish in a laboratory, and the embryo are tested for the defective genes, and only those without genetic defects are implanted into the uterus. Now we would come to the diagnostic part and then later on to the treatment part. Now, most children with moderate to severe thalassemia show signs and symptoms within the first 2 years of life. If your doctor suspects your child has thalassemia, he or she can confirm the diagnosis with a blood test. Blood tests can reveal the number of red blood cells and abnormalities in size, shape, or color. Blood tests can also be used for DNA analysis to look for mutated genes. And then the prenatal testing. Testing can be done before a baby is born to find out if he or she has thalassemia and determine how severe it might be. Tests used to diagnose thalassemia in fetuses include chronic wireless sampling, usually done around the 11th week of pregnancy. This test involves removing a tiny piece of the placenta for evaluation. Then amniocentesis, usually done around the 16th week of pregnancy, and this test involves examining a sample of the fluid that surrounds the fetus. Then what is the treatment? Mild forms of thalassemia trait do not need treatment. For moderate to severe thalassemia, treatment might include frequent blood transfusions. More severe forms of thalassemia often require frequent blood transfusions, possibly every few weeks. Over time, blood transfusion cause a buildup of iron in your blood, which can damage your heart, liver, and other organs. Then chelation therapy. This is a treatment to remove the excess iron from your blood. Iron can build up as a result of regular transfusion. Some people with thalassemia do not have regular transfusions, can also develop excess iron. Removing the excess iron is vital for your health. To help rid your body of the extra iron, you might need to take an oral medication such as deferoxamine or deferoxamine and Exjade, then Jadenu or Deferiprone. Another drug, defroxamine, desferol, is given by needle. Then stem cell transplantation, also called a bone marrow transplant. A stem cell transplant might be an option. In some cases, for children with severe thalassemia, it can eliminate the need for lifelong blood transfusion and drugs to control iron overload. This procedure involves receiving infusion of stem cells from a compatible donor, usually a sibling. Then lifestyle and home remedies. You can help manage your thalassemia by following your treatment plan and adopting healthy living habits. Avoid excess iron unless your doctor recommends it. Do not take vitamins or other supplements that contain iron. Eat a healthy diet. Healthy eating can help you feel better and boost your energy. Your doctor might also recommend a folic acid supplement to help you make your new blood cells. To keep your bones healthy, make sure your diet contains enough calcium and vitamin D. Ask your doctor with the right amounts what are the right amounts for you and whether you need a supplement. Ask your doctor about taking other supplement as well as folic acid and vitamin B that helps build red blood cells. Avoid infections. Wash your hands frequently and avoid sick people. This is especially important if you have had a spleen removed, such as splenectomy being done for other reasons. You will also need an annual flu shot as well as vaccines to prevent meningitis, pneumonia, and hepatitis B. If you develop a fever or other signs and symptoms of an infection, then you must see your doctor for treatment. Coping and support. Coping with thalassemia, you own or your child's can be challenging. Don't hesitate to ask for help if you have questions or would like guidance. Talk with a member of your healthcare team. You might also benefit from joining a support group which can provide both sympathetic listening and useful information. Ask a member of your healthcare team about the groups in your area. And preparing for your appointment, people with moderate to severe forms of thalassemia usually diagnosed within the first 2 years of life. You have noticed some of the signs and symptoms of thalassemia in your infant or child. See your family doctor or pediatrician. You may then be referred to a doctor who is specialized in blood disorder or hematologist. Here are some information to help you get ready for your appointment. What you can do? You must make a list of your child's symptoms, including that any seem unrelated to the reason for which you scheduled the appointment and when they begin. Then family members who have had the thalassemia, all medication, vitamins and other supplements your child takes, including doses you must bring at the time of appointment. And question to ask with your doctor for thalassemia. Some question to ask your doctor include: what's the most likely cause of my child's symptoms? Are there other possible causes? What kinds of tests are needed? What treatments are available? What treatment do you recommend? What are the most common side effects from each treatment? And how can this best be managed with other health conditions? Are there dietary restrictions to follow? Do you recommend nutritional supplements? Are there printed materials you can give me? What website do you recommend to search for my child disease? Do not hesitate to ask other questions you have. What to expect from your doctor? Your doctor is likely to ask you a number of questions, including: do symptoms occur all the time or come and go away? How severe are the symptoms? Does anything seem to improve the symptoms? What, if anything, appears to worsen the symptoms? And what are the best options he will provide to you according to the disease status and according to the criteria of the thalassemia treatment. So this was all about thalassemia. I hope so that this video will be more informative for the audience, and if you have liked this video, then kindly share this video with other individuals as well. And have a wonderful nice day, and kindly don't forget to subscribe my channel, and have a nice and wonderful day. And thank you and for listening and watching this video. Thank you very much.